Assalamu alaikum. Today's session about communication. I will start with the scenario. Mr. Jones, 75 years, known case of advanced COPD plus on-home oxygen plus mild dementia, developed severe community-acquired pneumonia, improved after antibiotics, penicillin and clarithromycin, but developed confused diarrhea and stool culture showed Clostridium difficile. There is deterioration in the patient's general condition and he became confused and irritable. The decision for palliative care not yet taken. Your task is to talk to his son, Mr. Kumar, and explain the condition and the treatment. We will start after the timer. After sharing the timer, we will start. Ready, Dr. Nusayba?
Yes, I am ready.
Yeah.
Still, I am in the clinic. Terrible situation.
So you can do the case or?
Yeah, I can do it. Just maybe some interruption, but one patient remain for me. Okay.
Okay, you can start.
Hello. Hello.
Hello, doctor.
Yeah. I am Dr. Abdul Karim, one Dr. Cover Clinic today. I am talking to Mr. Kumar.
Yes, it's me.
Yeah. What?
Yes, doctor.
Yes. You are next kin of Mr. John.
Yes.
Yeah. Mr. Kumar, we are here today to discuss some issue related to your father's condition. That is okay with you?
Okay, doctor. That's why I'm here.
Yeah. Mr. Kumar, you want anyone to attend our meeting today to give you support?
No, doctor. I'm okay.
Yeah. Mr. Kumar, how much you know about your father's conditions?
Okay, doctor. I know, as you know, that my father is old man. He has always been complaining of that lung problem, and even he taken his oxygen at home, and also he has some sort of memory problem, and I think it's called dementia. Recently, I know that he developed some sort of, I think, soreness in his chest, and then he came to your hospital, and I don't know what happened there.
Yeah, I highly appreciate your knowledge about your father's condition. Mr. Kumar, before go further in our discussion, let me to know about your expectation from our talking today.
Yes, doctor. I think because he has this lung problem, I expect that he will just give some sort of treatment and will go back home.
Yeah. I highly appreciate your concern. Before that, we'd love to discuss your father condition in details. After that, we'll ask you all your concern and what would be further to be done for your father.
Okay. Okay.
Okay. As I understand from you, your father have been troubling with some bug infection in his chest. Because of that, is admitted to hospital and start antibiotics, which is some drugs through the needles, which is for his chest bug infection. But unfortunately, his father have developed new symptoms that are loose motions. And you are with me, Mr. John,
Yeah.
Mr. Kumar?
Yes, doctor. Yes, doctor.
Yeah. Develop loose motions, and this condition due to what is called pseudomembranous colitis. You have idea about that?
No, doctor. What is this problem, doctor? And what is the cause of this problem?
They can hold timer for me for a while. Just
Okay.
wait.
Okay.
Yeah. Hello?
Yes,
go ahead.
Yeah. As I understand from you, Mr. Kumar, your father have been troubled with some bug infection over his chest. Because of that, he's go to the hospital to be admitted to hospital. And because of that, he received some medication through the needles, antibiotics called antibiotic for bug infection. And unfortunately, your father have been developed this loose motion. You are with me, Mr. Kumar?
Yes, doctor.
Yeah, this loose motion due to some bug called Clostridium difficile. You are here about that?
No, doctor, what is it?
Yeah, it is bug infection through the gut of your fathers, and this is the one of the adverse effect of giving that antibiotic to your fathers. It is one of the adverse effects of giving antibiotics through the needles.
So you mean, doctor, that instead of treating him, you got him another disease? So this caused because of the medicine that you gave him?
Yeah, I highly appreciated your concern, Mr. Kumar. It is any medication given to have some adverse effect. In your father, this antibiotic given for chest infection, actually your father developed one of the adverse effect as this organism, this loose motion was of the adverse effect of that antibiotic given to infection over his chest. Yeah, with me.
Okay.
Yeah, unfortunately, Mr. Komar, your father condition is not well and is go advance. And our team do our best to care about your father. But actually, your father not respond to the treatment and his condition deteriorating, and now is in his critical condition.
You mean that he's dying? Yes, you mean that he's dying?
I'm sorry to tell you that yes, your father is not well and he's in critical conditions. And but make sure we are here to help you and to help your father and give the care as the best of interest, and will not leave alone. Will not leave your father alone and do our best for him.
Oh my goodness, doctor. This is very hard news for me. So can I visit him?
Of course, Mr.
I
Komar.
just because since he's dying, just I want to visit him and I stay with him, doctor.
Yeah, now your father condition is critical and he's in critical care units or what is called ICU. Really, I don't know the regulations about that to be visit and regulation of that place. Really, I don't know. Let me to ask our team and ask our consultant and to go to regulation of the hospital, and I will do my best to help you regarding this issue. You are with me, Mr.
Yes,
Komar?
doctor. So yes. So how are you going to treat this loose motion, doctor?
Yeah. For this loose motion, our team do our best for treating this issue, and will be treated in the multidisciplinary teams. That team with the intensive care unit doctors and gut doctors and specialized staff nurse would do our best with to not let your father to be dehydrated.
Okay.
Yeah. And because of that, our team have been discuss what is called the palliative care. You hear about this issue?
No, doctor. What is this?
Yeah. Palliative care is care given to patient who is the terminal patient, who is the dying patients, and this care will take care of your father feeding, and that will care about his feeding and will care about his infection, to give him antibiotics, and to care about if febrile we'll give him some antibiotic. If have any pain, we'll give him painkiller, but will not be active management for his condition. Try to support your father to live in comfortable for remaining his day. You are with me, Mr. Komar?
Yes, doctor.
Yeah. And this palliative care teams our aim to keep your father comfortable and keep dignity. And but if your father heart stop when not doing massage or give a needle of drugs through the needle, as this one gives this for the patient, it is hope to be revived, or to there is hope for him to be revived. In your father condition, is a very difficult and very revive, and so our team decided to be have not to do this resuscitation. You are with me?
Yes, doctor, I'm with you.
Yeah. Any concern, Mr. Komar?
Yes, doctor. When I visited my father last time, I saw feces in the bedsheet. Could be behind this disease and his deterioration in his symptoms?
What? Seeing what?
I see feces on the bedsheet.
Actually, no. Actually, no, Mr. Komar. These infections is this IV, this medication give through needles, kill some normal helpful bacteria in the gut, and because of that, they're overwhelming of the other bacteria, and that lead to these causes. But it is not actually that's what's seen is the cause for your father condition.
Okay, thank you, doctor.
Yeah. Any more concern, Mr. Kumar?
No, thank you, doctor.
No. Mr. Kumar, your father supporting anyone of his family?
No, doctor. He's old man. He's retired for a long time. We support him.
Yeah. Really sorry for that, Mr. Kumar. I'm really sorry who won't deliver this news for you.
Okay, thank you, doctor.
Yeah, thank you, doctor. Do you need any support, Mr. Kumar?
No.
No. Thank you.
Okay, time is up. I added 1 minute because of the interruption, and you repeated some explanation at the beginning. So let's hear the comment from Dr. Abdullah, and let's really thank Dr. Abdullah for bringing this scenario, because it's a common scenario, and yeah, there is some misunderstanding for this scenario. Let's hear from Dr. Abdullah, then I will correct after. Yeah, thank you.
Okay. So you did very well, Dr. Musaiba. You were fluent and tried to explain in simple ways. But I have some comments for you, if you don't mind. I think from the start here, when you told the patient that you are the next of kin, so is it wise to tell him if anyone want to attend anyone with you? Because here I think it is a matter of confidentiality. So it's better to ask someone to attend the meeting with him if the patient is himself. Here, I think it's a matter of confidentiality, so no need to attend someone with me. The second comment, I think when you started, you said that you have a disease called pseudomembranous colitis, which is not written as a scenario. But the second time you corrected, that is the Clostridium difficile. But the most important thing that did you read the scenario very well, Dr. Nusayba? Because this is one of mistake anyone can be falling. Please read the scenario very well, because they mentioned that this patient, palliative care not taken yet. So you offered palliative care and you offer that DNR, which is, I think, not in your task at all. Your task is, it's very important to know your task. Please read your task very well and write it in your paper, because your task explains to him the condition and the treatment. That's why, because this Clostridium difficile, one of the communicable disease, which is notifiable in this case. because here the treatment is different. You need the isolation, you need special care. So you forgot isolation because you focus on the palliative care, which is, I think, mentioned here clearly, the palliative care not taken yet. So your main task is to explain the situation and the treatment. Then when I told you that the second concern was, can I visit him? Which is visiting him, there is no problem in visiting him, but staying with him is not acceptable because this can contract the infection. If we divide the communicable, I mean, infectious disease to notifiable and not notifiable, the notifiable disease like tuberculosis and meningitis, you cannot offer, you are not allowed to tell the surrogate to visit the patient. But in case of Clostridium difficile and this Clostridium and what else? The second infection, you can visit him, but you cannot. MRCA, yes, thank you, Basim. MRCA and Martha or MRCA. So in case of Clostridium difficile, you can allow to visit under specific precautions, washing your hand, don't touch the surroundings or the patient base, but you cannot allow him to stay with the patient because he might contract the infection. And the second comment, you offer DNR. I think DNR, they will mention clearly in the scenario if you want to explain, because you only have 10 minutes and the case is calibrated well for this 10 minutes. So if you want to explain the palliative care and DNR, definitely time will not be enough for your case. The most important thing when my concern or third concern, I saw feces on the bed sheet. Here you have to apologize. You have to apologize. And incident, you told him that incident report will be raised. This is very important. Whenever the patient or the surrogate see something that not professional or not practical, you have to apologize. This is a common this is a common concern. Yes.
يا دكتور عبد المنعم means that إنه السيناريو كله كان ماشي على communicable disease أو
infectious disease, yes, Clostridium
disease. يعني yes. البداية حقتي أنه to explain the disease is the right أنه هي كان IV is the right one or in going in diverse direction.
Okay. Regarding the explanation Hello? Of yes, can you hear me? Hello?
Yes, yeah, we can hear you, Dr. Al-Menem. Go ahead.
Okay, how to explain the Clostridium difficile? In Clostridium difficile, you can tell him that we have in our gut, we have good bugs and bad bugs, and they live in balance when we take antibiotic, it will kill the good bugs, and so that the bad gut bugs, I mean, multiply and produce toxin, which cause the soreness in the gut leading to loose motion. And these good bugs can be killed by the antibiotic. This is how to explain the disease. The plan of management.
معلش ثاني دكتور عبد المنعم، معلش ثاني.
Okay. How to explain Clostridium?
كان الصوت بقطع.
Okay, sure. How to explain Clostridium difficile? Okay. You started very well that your father admitted because of the chest infection and given antibiotic in the chest in the best of the rest of your father, but unfortunately he developed side effect of this antibiotic. We have in our gut good bugs and bad bugs, and they live in balance. When we take when we take antibiotic, it will kill the good bugs, so the bad bugs will multiply and produce toxin, which cause soreness of the gut leading to the loose motion. This regarding the explanation. The plan of management, isolation the patient to the side room to prevent transmission to others. You have to mention this isolation for the surrogate and inform the infection control team. Then the patient condition deteriorated, confused about the patient. So here I think it might raise the last power of attorney and advance directive, but it's not wise to ask to raise the issue of DNR or palliative, because in the scenarios they mentioned that clearly palliative care is not determined yet. So AD and LDA should be raised. So the third concern, I think this is regarding the concern. So one of the concern was raised why you gave him this antibiotic. I think this concern you addressed it very well. One of the concerns that raised by the surrogate, I am afraid that he got infection from your hospital. So in this case, you assure that this is they have a policy which is infection control, and they have a strict policy to prevent this disease to be happen. So okay. When I came to visit my father last time, I found feces to the bed sheet. Here, this you have to apologize and incident report. We apologize for you for this. This is not acceptable for us, and we will inform the nurse in charge, and incident report will be written to prevent this to happen again in the future. Sometimes may raise the concern of complaint for this feces in the bed sheet. Yes, it's your right, and I can guide you to both or patient advice and liaison service. So I think the last concern that I want to visit him, I want to stay with him. Yes, you can visit him, but please inform the nurse to take some precautions like wearing gloves and wash your hands. And we are not recommend to stay with him as prolonged contact may transmit the infection. So here, when I ask you for visiting him, you shift to the regulation for the ICU, I think, right? So here, the concern related to the infection disease. So this regarding the concern, I think, yes, the last thing in the social, I think it's better to ask anyone live with your father or no, because he is elderly and already have multiple comorbidity. So I think it's more important to ask if he has someone to take care of him or no, because if there is no one, you can offer social worker or something like that, or community nurse to help him regarding this. And that's all. If anyone correct me or add something.
Yeah, thank you, Dr. Abdul Manan.
Assalamu
Actually,
alaikum.
Walaikum assalam wa rahmatullahi wa barakatuh.
Just I have one comment, Dr. Abdul Munaim.
Okay.
Regarding if she mentioned I saw feces, you didn't need to apologize. You just say sorry about what has happened, and I will raise it for the nurse in charge, because you are this uncertainty. You are not sure about what she has said, and in the same time you won't confront with her. So just you will do. I'm sorry regarding what you said, or I'm sorry about the situation, and I will raise it for the nurse in charge for further investigation, and that's it.
Okay, thank you.
Okay, thank you so much.
Okay, thank you, Dr. Sabrine. Let me answer this point first, Dr. Sabrine. Sorry. When the patient or surrogate say something, we should believe and we trust. So the patient or the surrogate is right until proved otherwise. Yes, uncertainty, we are not sure and we will investigate. But if you say that, means that you are not believing here, and this also will put you in trouble.
Now, you already
I
said
think
sorry.
this is it, yes, because
Yeah,
I think
you
this is
already
not
said
the
sorry.
patient.
I agree. You said sorry, but don't say we will. As you said, it's not uncertainty. I know you apologize or you said sorry. It's the same. For me, I will apologize because this is not accepted. Why? Because the nurses should clean and should do everything before visiting. Even the faces, it will not be appeared on the sheet. There is what's called diaper and some tools to use not to show this in the sheet. So once the sheet is like that, means the care is not perfect. This is my opinion. I don't know. Maybe
I
you're
think
right as well.
Dr. Sabrine thinks that if you apologize, this can be shifted to medical error. Is it true, medical error or no?
Yeah, we shouldn't admit that there is an error has happened unless there is evidence. Maybe they have just changed and she had loose motion. They have just changed it and it gets soiled. So the point is, sorry about the situation. I will raise it to the nurse in charge. That means an action will happen, and just to ensure that won't happen again. But we shouldn't admit there is an error has happened or some negligence, because this can go into the negligence scenarios.
Okay. Again, I am repeating
Assalamu
this
alaikum.
concept. Alaikum salam wa rahmatullahi wa barakatuh. If the patient or the surrogate saying something, we should believe on and trust. This is what I learned. So yeah, once he say that, yeah, he is right, and we should do what Dr. Aminam said. We will raise the issue to the nursing supervisor or nurse in charge. They will investigate and they will correct this. So it's considered as a mistake. For me, I consider it as medical error. Shouldn't be there. And the apologize for that, it's okay. Why? Because it's a mistake. I should apologize. The patient or the son, doesn't need to see this. This is my opinion. Okay. So, Dr. Sabine, if you can follow my advice, it's okay.
Sorry,
If not,
today I have
yeah.
attended a course, and they said the way that I said that if there is uncertainty in any situation, we shouldn't admit the error unless it gets investigated, because sometimes patients can lead you to admit some error that is not true. From their point of view, it's an error, but in the real life, it is not.
Yeah, but don't show the examiner that you are not trusting the patient.
Yeah,
You should
yeah,
trust.
so it's the same as you are trusting your colleague.
Yeah.
Or so if the patient said they haven't prescribed my medication, but you are not sure what have been written in the note or in the drug chart, so you will go to see what is happening, but what you will say the patient, so you don't want to upset the patient. You will say, sorry about what has happened. We will get you another feedback later.
Yeah,
or we'll investigate that one as well.
Yeah, this is when you are not true about something prescribed by your colleague, but the patient said that and you don't know the circumstances.
Yeah.
For me, yeah, I will do what Dr. Abdulmanam said, and this is the perfect way how to correct this mistake, because it's a mistake to see, sorry, to see this dirty sheet during visiting time. This is even in the real life. The family doesn't. It's not good to see something like that in the sheet during visiting time. Anyway, let's. Someone was talking. Sorry, I interrupt him. Who was?
Assalamu alaikum.
Alaikum salam wa rahmatullahi wa barakatuh. Yes.
Actually, يعني it's
Dr.
a
Hassani,
very
yes.
common scenario. نعم.
Yeah.
A very common scenario and very confusing, because the medical error and the medical negligence is like a gray zone. And actually, I have many confusion. Still have many confusion يعني regard this topic. Actually, the explanation of Dr. Abdul Mun'im was very good, because I have the same points that I would like to tell the doctor who make a role of the doctors in this previous scenario. But I have just one point regarding the explanation of disease of Clostridium difficile, of if the written in the scenario Pseudomonas branchiolitis. We should talk about the nature of the disease, the pathophysiology, as Dr. Abdul Mun'im said. Then it is communicable disease, notification, isolation, and screening. I think in the Clostridium difficile we have no screening like in TB, but we should told the relative about the isolation in the side room. And in the beginning, the relative he will reluctant this approach in the side room. So we can convince him about not to spread the infection to the other staffs and to the other patients. The important point, I give him a warning shoot regarding the future complications of the Clostridium difficile. And even in the scenario, it's written that the patient is confusion and irritable. So the patient, it's near, let's say, the ICU care. So we can give him the possible complications. and the cause for these possible complications. We can say because of his comorbidities, because of his hypertension, COPD, because of his age, all these risk factors for these bug infections to occur. And these all risk may increase the chance of duration. This is number one. And number two, I think there is a clinical judgment hidden in the scenario regarding the treatment. Okay, the treatment side room isolation and supportive treatment like IV fluids, like others, supportives and drugs anti-sickness. But we should say to the patients, we will give him the antibiotic who killed this bug infections. There's a new bug infections. And the possible concerning for the patient, he will tell you, you give him antibiotic that lead him to this situation, and you now also give him the same antibiotic. So now you can say, I appreciate your concern. It is normal to think in this way, but this antibiotic we are used him by oral supplement or by even rectal supplement is to kill this new bug infections. And so he has no complication as the penicillin does. This is important questions also on the clinical judgment of the treatments as whole and for the patient concern. Regarding the apologizing, okay, this is we are all agreed it is a gray zone and confusing points. In the beginning of the scenario regarding the penicillin side effect, I think it is not a medical negligence. It is medical error. So we can say, I am sorry, and talk about the possible treatment and how to treat, but don't apologize because it is one of the possible side effects. It is not an intentional error. Okay, it is like amiodarone-induced fibrosis or methotrexate-induced cirrhosis. So we cannot apologize, but we empathized with the patient or relative. But when he said about the feces in his bed, I think we should apologize for this because I don't think that the relative is lying in like these situations. So I will go with the opinion that said that we should apologize in these events and reassure the relative. We will talk with the seniors of the nurse in the ward, and I will talk with the consultants, and by myself I will observe your mother or your father's, and I will make incident report for this incidents. And thank you.
Okay, thank you, Dr. Hassanin. I will comment, Dr. Nusayba, any
please.
comment else? Yes, who? Dr. Abdullah?
Sorry, I have one question, please.
Yes, sure, Dr. Mustafa.
Yeah, regarding this scenario, he is mentioned here, decision of palliative care not taken yet. So shall we discuss with the surrogate that the decision of palliative care might be discussed with you in the future?
No.
So
The task is clear. Yeah, this task means don't talk about it. And if there is clear plan to talk about it in the next meeting, they will write for you. It will be decided soon. So no need to talk about it at all. Just explain the critical condition of the patient, and the support will be given to the patient. And as Dr. Abdul said, the lasting attorney and advance directive, because might the patient condition worse more, and in this situation, you should take the decision for the wishes or the lasting attorney earlier, because the patient capacity already disabled from this point. I mean from this time, because he's already confused. He might not regain his conscious level again, and that's why you should ask about these things. Is
Okay.
it
And
clear,
also,
Dr. Mustafa? Yeah.
regarding also the same point which the surrogate raised when he saw feces. So can we be in the middle that we can tell the surrogate I'm trusting you, but at the same time I'm trusting my colleagues and I
No,
believe that
no,
and
no,
this
no,
is
no,
not our practice, but I will investigate and I will update you, or to make it as
no.
his answer.
Even he's
He might
yes.
be in wrong. He might be wrong here.
No. Yeah, I agree. I agree with your opinion. Even he will see the face something dirty rather than faces, and he will say this is faces. You should believe him and trust him. It's dirty by any means, and
Okay.
we will investigate why it was dirty, and we will call to change, and we will prevent this mistake to be happened again. Don't tell no someone will correct or will be giving us the proof that it was dirty. No, he is right till proof otherwise. And don't show him that you are
Dr.
debating
Basim,
or arguing with him. Yes,
okay,
Dr. Hassan.
okay.
Okay.
يعني the point of the يعني apologizing in this يعني situation, why the
Yes.
relatives say that he saw the feces in his bed. يعني the
Because
relatives say that because you told him that the cause of your mother or your father deterioration in his condition because of bug infection inside the hospital. So he
no,
said yes.
it's not like
You
that.
told him that because the Clostridium difficile side effect of the antibiotic that that patient
Yes, antibiotics
took in.
related, but no,
Yes, okay, but يعني the whole situation occur inside the hospital. It is like a hospital acquired infection. So we expect that the يعني relative he make a bad point toward us, like he said feces, like he said that the nurse took blood from his mother.
yes, yes.
He did
This is
wash
Sister,
by the way,
maybe
this
go
is
back to
wash.
same patient. NG not flushing. Maybe go back with me, okay?
by the way, Dr.
Sorry.
Hassanin, it's real. Yeah, it's real situation. If
Mhm.
if the patient has any infection by any type of infection, and we put isolation, contact isolation, the family always attacking the doctors and the department. He got the
مظبوط.
infection because
فلذلك
yes, I agree.
Mhm.
There is like this real
Mhm.
in the real life, but
Mhm.
don't assume that it's already transferred from the hospital. You will be in trouble. Okay,
No. I
even
don't assume
there
this.
is
Yes, I would like to say we should expect
If you know.
the blaming of the relatives toward us. Okay, so in this point, I can I can apologize for him. Okay, and I will investigate and I will update him about the incident.
yes.
Right.
Exactly.
Mm.
Okay, I didn't comment on Dr. Musaiba because I have some comment different with Dr. Abdulmenaim. Sorry, I will not take long. I'll try to make it short as much as I can. So for the point of asking for invitation, Dr. Abdulmenaim, uh, in this patient, I can, for me, I can invite. It's not accepted sometimes, but it's okay if you invite. Why? Because the patient already lost his capacity. He's not conscious anymore. So when the capacity is lost, you can invite someone to explain about the critical condition of the father. For example, the son and the brother. Yeah, I mean the other son to support him and so on. And this is not confidential anymore because he lost the
Yes,
capacity. Yeah.
very important.
If
Yes.
if the capacity is preserved and the patient still awake and he can take decision and he can share, this time it's not allowed to invite someone else, and you will assume that you have permission from the patient to talk about his condition. But once the patient
Mhm.
lost his conscious level and the capacity in this situation is lost, you can invite
Yes.
any person. Okay, especially those who can
Actually,
support
yes,
the relative.
yes.
Yes.
The confidentiality, I think it is يعني a little topics we should not to breach the confidentiality in the HIV and in the يعني sexual and transmitted disease and sometimes
Yes.
in the XDR or MDR of the TB because we cannot bring other person to attend with these infectious patients. I think
Yeah.
these all about the confidentiality.
Yeah. And
But
add to them,
regarding the third, yes.
suicidal attempt as well.
Yes, I'm sorry. Okay. And يعني
Yeah.
suicidal attempts. But about the third person to attend, I think it is work as a warning shot, as Dr. Nusayba said, to support you, to support you. It's like a
Yeah.
warning shot to a bad news coming.
Yes, I agree with you, Dr. Hussein. And it's
دكتور
okay if
باسم
not inviting. Yes, Dr. Hussein.
دكتور باسم معلش أنا كان the network is not with me. How to say the patient is a communicable disease and should be in isolation. يعني discuss about the bug when he has antibiotics, he has side effect adverse effect حتى to have this loose motion, the cold received. Okay, how to say to the patient now your father inside in bedside rooms
Side room.
and
Yeah.
side rooms and he's a communicable disease. How to say this places for the
Yes,
surrogate.
it's one of the serious infection and can be transferred to another. That's why we put him in a side room. That's it. No need to mention the communicable disease as a word because it's jargon.
Need notifications.
Yes, infection control notified about this, and they are following this patient. This is in real life as well. We are doing that. Pseudomembranous or Clostridium difficile infection, the infection control team are following this type of infection. The same as MRSA.
Dr. Basim, معلش, I
Yes,
think
yes, yes, yes.
Clostridium difficile is not notifiable. It is yes, need isolation, but not notifiable.
Yeah, I have the list for notifiable disease.
Yeah, and the notifiable disease is COVID, tuberculosis, and meningococcal meningitis.
Okay. I will confirm because I have a list of notifiable disease. Then I will send it to the group. Okay. Okay, let's continue explaining Dr. Nusayba the case. So introduction was great. The next of kin, okay. The invitation, I will not minus you in this situation. But if you didn't mention, it's okay as well. The idea about the disease, the expectation, you did all the introduction well. The explanation, you explain it in the good way. But as Dr. Abdulminam said, our gut include or they contain some bugs which are harmful and the other which are harmless or good and bad like this. And there is continuous balance between both of types of bugs. If we started some antibiotics, one of the adverse effect and wanted effect of this antibiotics is to kill the good bugs. And the bad bugs or the unwanted bugs will be overgrowth and they will produce the toxin. So it's a matter of imbalance between the good and the bad bugs, although it's living inside our body. Why? Because of starting antibiotic. And as you did, I like this time you follow him in each sentence. And you ask him, are you following me in each sentence? And you didn't lose the conversation with. And the same time you mentioned antibiotic, tell him and the antibiotics was prescribed for the best interest for his condition. Why? Because we are giving this antibiotics in such infection. So it's not a mistake, just to show him that we started the antibiotic, but one of the side effects, although it's rare and few cases might happen, but it happened with your father. That's why we stopped this antibiotic. You should talk about the action. We stopped the antibiotics and we started other antibiotics to kill these bad bugs and to return the situation to the normal or near to normal situation. This is regarding the explanation. The other point, yeah, will my father die? You told him yes. I agree you can say that, but it's not the first answer because still the patient not yet decided even for palliative. You can say he's in critical condition, and because of his comorbidity and his diabetes, hypertension, COPD, his immune or defense system is weak, he might in the future have certain complications up to death. Yeah, you answered the concern about die, yes, but it's not because of the infection. Now you show him that he will die because of the Clostridium difficile, but it's not. The death will happen due to the comorbidity rather than being due to the Clostridium difficile infection. Okay, I wrote the concern and mentioning one by one. Yeah, doctor, I want to visit my father. Your answer was away from this scenario. I guess this scenario, Dr. Nusaiba, you didn't practice this scenario before, isn't?
Yes.
Yeah,
Actually,
that's
I
why.
have some problem
Yeah,
with the communicable disease.
no. This scenario is
one
common
of
and
my weak point.
it's okay. It's okay. Good, Dr. Abdullah, bring this case. It might come to you in the exam. Really. And the ICU is not an answer. I will ask ICU team to tell you how. Okay, it's an answer, but if you practice this scenario before, you know the answer. And all the scenario steps and concerns known for those who practice this case. This is one of the concerns. I want to visit. I appreciate your worry and your care about your father. We have some rules and precaution to visit him, but we can't let you stay with him in order to prevent transmission of this disease. Okay, so he can visit, but please, there is some precaution, which are good hand hygiene before and after, and you will wear some gloves and maybe the gowns. And please provide less visitors. So the only first degree can visit him. If you want to talk more, yeah, to utilize your time. But for the visit concern, it's enough to say what I said. Yes, you can, but there is some precaution. And we put him in a side room. This side room, even some visitor can see him from the window. It's glass one. You can see him. Who's want to see him from far away or from the window. But the one who want to go inside, they should do hand hygiene, hand washing, and wear gloves and yellow gown. Okay, this is for the visiting. And the staying, as Dr. Aminam said, not prefer to be stayed inside the room in order to prevent further infection and transmission of the disease and not to contract the infection from your father. Yeah, then the palliative management, you shouldn't talk about it at all. You should read the scenario well, as Dr. Abdulminam said. Read every single word in the scenario. You might see no, not yet taken. You might see it as taken. So try to read the scenario twice. And every point and every word and every sentence, be sure that you read it well. Because no, sometimes you will, by the stress, you don't see no, and you will talk about this, that the palliative, such case. And it was no, don't talk. Okay? The resuscitation as well, because we didn't talk about palliative, why you mentioned resuscitation. So the point, if you read or misread the sentence or the task, you will talk wrongly all the scenario and you might fail the station because of misreading. And the face is point, as you did, or Dr. Abdulnam said, apologize, raise an insert report, we'll inform the supervisor, we will change the bit sheet, and so on. So the most common point to be raised here, the isolation, the precaution, the infectious control team, and the visiting time or the visiting to the patient. This is how this scenario drive and how you should do. The support at the end, and you can ask also for the lasting about attorney and as the patient being confused, and the lasting about attorney and advanced directive. I think it's clear now, Dr. Nusayba. Okay.
Yes.
Let's read the comment. Please, Dr. Nusayba, write your scenario for Dr. Abdullah
Yes,
until I
already
read
written in
the.
chat the
in
box
the chat
already
box?
written. Yes.
Okay, thank you.
Dr.
Dr.
Basim,
Aminam,
Dr.
yes,
Basim, I think the examiner
yes.
will minus the candidate. If he didn't talk يعني correctly or thoroughly about the specific management of a Clostridium difficile, because the antibiotic, it is very important. You know, the Clostridium difficile is يعني a resistant bacterial infection and may kill the patients. So one of the cornerstone in the treatment is antibiotic. You should talk about the antibiotic. You should talk. We will
Yes,
give your
yeah.
you will give your father an oral, not IV, oral and maybe rectal antibiotic. And at this time, I think the surrogate will told you that you because of your first antibiotic, my father condition deterioration. So now also you give him the same antibiotic, or you want to kill him again? This is very important things, okay? And so you should prepare yourself for this concern. And the very most important things in this infection is talking about the antibiotic in the treatment.
Yes, Dr. Hassan, I said we will stop the antibiotic and we'll give the antibiotic will against this organism or against
Again,
this bug. I said yes, I said that.
مضبوط.
By the way, it's not
مضبوط.
only oral or rectal. There is IV metronidazole according to the grade. There is mild and moderate and severe.
Yes.
Yeah,
According,
there is
yes.
yeah,
Yes.
metronidazole IV, maybe vancomycin oral.
I've been tried as well.
Yeah, there is
And
steps and
even
grades.
stool, yes, and
Yes,
stool in transplantation, and
yeah, that's one of.
يعني even surgery colectomy or
Yeah, but you will not go deep to this details.
yes, I agree. I agree
Okay.
with you. Agree.
Yeah. Okay, Dr. Zain, I think someone asked, what's the lasting power of attorney? The lasting power of attorney, the person who will take decision on behalf of the patient if the patient already lost his capacity. He's not conscious anymore, and he will take the decision on behalf of him. Also important, Dr. Zain, also important to say what action does antibiotic stopped, another antibiotic medication, yes. Given fluid monitoring, yes. Yes, we mentioned this, Dr. Zain. Thank you for reminding. Where is the scenario, Dr. Nusayba? In the group?
Yeah, in the chat box.
I can't see
In
the
chat box.
scenario, Dr. Musab.
You can see?
No.
No one
In
can
the
see.
chat
I
box.
didn't see also. I'm sure. Maybe you put it as reply to someone?
Meeting, chat
No,
meeting.
no. It's not there, Dr.
Chat
Nusayba.
meeting.
Yes, I can read all messages. I can't see.
Direct message. Direct message to Dr. Zain. Yes.
Direct message to Dr. Zain?
Yeah. Chatting.
Dr. Zain, you can. I didn't see
No, I
also
will do
there.
to everyone. Okay. Now do to everyone.
Yes, yeah. Now we can see. Read the scenario of Dr. loudly, Dr. Abdulmanan. Hello, Dr. Abdulmanan, you can read the scenario?
Yes. This 1 minute. Yes, it's clearly now.
Okay, read it loudly, please. Let us
Okay.
hear it.
30 years old, complain of headache, fever, neck stiffness, and skin rash. CT was done and LP was done, confirmed the diagnosis of meningitis. Patient deteriorated and admitted to ICU. Talk to his wife about plan and answer her concern. Okay, just give me 2 minutes.
Yeah, similar scenario to yours. By different way. Yes, take 2 minutes, then we'll start. We'll start 11:40.
السلام عليكم ورحمة الله وبركاته دكتور باسم.
عليكم السلام ورحمة الله وبركاته. أهلا دكتور إهدى.
I'm confused for certain point.
Yes, sure.
It is an error approach or not? First one. Second, the comorbidity or Clostridium, it is a cause for deterioration. If the patient asks. Thank you.
Yeah. So Dr. Ihda, always think about the mistake or the error by your feeling. What do you think if you see the sheet for you, the patient relative to you, بعد الشر يعني, and the sheet is dirty with some faces? What do you think? Is it accepted?
No.
Yeah, so it's a clear mistake.
Accurate.
Or negligence, whatever. It's again a mistake or medical error not to be happened in the hospital. Okay, so always follow your sense. What do you think about this issue or this event? If you feel it's accepted, okay, don't apologize. But if you feel by your sense like it's not accepted at all, so please apologize immediately. Absorb his anger because he will be angry because it's not accepted behavior. Okay, regardless the trust or no. But once he said, you should trust, and it shouldn't be there. So you will do the error steps, incident report, calling the supervisor, and analyzing about this mistake, investigating, and so on. And the action, of course, you should do the action. We will call and we will change the sheet, and we can even call for laundry to take care of these things. Okay, this is regarding the first point. The second point, the Clostridium difficile as infection, it will kill him or the comorbidity. So according also to his comorbidity, he will have the Clostridium difficile, because if he didn't get the infection, he will not take the antibiotics and he will not be there. And the infection of Clostridium difficile toxin will not be also there. But since he's the one sick and he got the infection and you start the antibiotic, so initially the problem from his comorbidity. Is it clear now?
Thank you, doctor.
Yeah, so it's related to his comorbidity rather than being related to the Clostridium difficile. Not everyone taking antibiotics, his immunity will be like this, and the body will react like this. Those with immune compromise, they will be in this complication or side effect. Okay. Let's go to the scenario. Are you ready, Dr. Almina? Drug side effect, not medical error. We are not talking about the infection. We are talking about the dirty sheet. Some points to be clarified. I hear also some doctors talking about the apologize for the antibiotic start. No, it's not related to the antibiotic side effect. We are talking about the apology for the dirty sheet with faces. So we are not talking about the drug side effect. Yes,
okay,
Dr.
Dr.
Hassan.
Wasim, I would like to ask all my colleagues, if I give the patients amiodarone or methotrexate, or I give him penicillin and develop Clostridium difficile and pseudomembranous colitis and colectomy, and he did, if I can suppose. Or even I give him methotrexate and cause him liver fibrosis or cirrhosis or decompensation liver failure. Actually, I have one of the patients in my ward in the hospital, because of methotrexate, she developed decompensation liver, acute liver failure. So I would like to ask, in these situations, when I give the patient the drug in his best of interest, like penicillin, methotrexate, amiodarone, and he developed this serious complication, it is medical error or not?
No, it's complication and side effect. The error will be if you didn't sit with the patient and give him the information about possible side effect, even even a small or even few percentage. You got it. So the side effects is there, but the patient might tell you, no one told me about this side effect. And that's why I didn't refuse the medication. What you will do in this scenario?
You
You got
mean
you
if
got
I
it.
yes
Yes,
you mean if I explain to the patient about the side effect,
yes.
it is
Excellent.
not medical error. If I don't
Yes,
explain, or if I
excellent.
didn't explain to the patient, it's medical error.
Yes. Yeah, exactly, exactly. So if the patient pretend that no one and his GP didn't talk about the side effect of certain medication, now you can consider as error, because every medication before starting we should sit with the patient and explain to him the side effect. This is not error, but once you didn't explain and the side effect happened, because this is another scenarios. There is a scenario like this, amiodarone and lung fibrosis. Why it happened and he didn't tell me. So in this step, what you will do? You should apologize on behalf of the mistake. I don't know who's the one prescribed for you. Usually we sit with the patient and we explain to him these side effects, although it's low and it's a few percentage, but we all
Okay.
explain. This is our habit. For that reason, we can talk.
Mhm.
Yeah, we can. You might have chat with your GP, and you can, if you want, if he asks to complain, yes, he can complain GP surgery, and to investigate more about this, why he didn't tell him about the side effect, although it's low or a few percentage. You got it?
But yes, but I think even his GB, didn't explain to him well or very well the side effect and the follow-up of all the investigation. He didn't do
Yeah.
that. Even with these circumstances, I think I should not do apologize. What do you think?
No, it's not apologize for the meaning of the apologize. This is mistake from you. I told you apologize on behalf of the behavior of or what happened. Like you feel bad for him, and I'm sorry for what happened to you. Like this, it's not a mistake from your side. Let's say, like being sorry, not to apologize. Yes, I am sorry for what happened to you. I am sorry to hear about that, and we can see
I am
more
sorry,
about that.
yes, without
Yeah.
apologize.
So I am sorry.
Yes,
Yeah, without apologize. Okay.
yes, without apologize. So the book of the يعني صادق الرخ, he has
Yeah.
appeals a golden point يعني regarding this gray zone and confusing point. He said in his book, when the treatment was in the best of the interest
Yes.
and the error occur unintentionally, so
Hmm.
make sorry without apologizing. But when the treatment occur by negligence or by not give the patient the standard care, now you should apologize.
Yes.
Yes. So
Yeah.
I think that yes. So I think there is sometime may occur overlapping between these terms, error and negligence. I think the
So
penicillin side effect. I think it is error because it is has because it's harm. It was harmful to the patient, but
no,
not
why error?
apologizing.
Why error
اتصل على
penicillin?
عمران قولي عندنا زيارة.
Why
I think
error?
the book.
العيان
I
الأنبوب
think
حقه ما مشى.
explain this thing يعني very well. يعني the book writer said that this error in any way it's error, but it is not intentional error because it is not يعني مثل negligence. It is a side effect, and the first drug was in the best of interest of the patients. So it is not mistake, but in any way it is error because the methotrexate may kill the patients. Okay, you give him to the patient because of
No, no, Dr.
active
Hassanin.
rheumatoid arthritis.
Dr. Hassanin, there is another scenario you might talk about, which is methotrexate and cotrimoxazole, Bactrim. This is an error to prescribe medication interact with methotrexate, and it might lead to methotrexate toxicity. This is an error.
Actually, it is confusing, still confusing to me. Okay.
Yeah, there is
يعني
there is more scenarios, or there are more
yes
scenarios
more scenarios.
about the prescribing medication. But once there is interaction without notifying that there is medication already the patient on, this is an error. But if the patient taking antibiotics and the side effect happen without any interaction, why it will be error? It's a side effect and it's written there. But your scenario,
Okay.
you are talking about another scenario, which is methotrexate interact with antibiotic, which is cotrimoxazole, due to the same side effect, which is bone marrow depression, and the patient will have more leukopenia, and he will have further infection and anemia and low platelet count. This is error to prescribe medication while the patient on some medication and you are not aware about. This is a major mistake, and you should deal with these scenarios as error. Okay, it's clear now.
So in this situation, I should apologize or sorry?
Yes, of course. Apologize because you didn't take care about his own medication or home medication. Patient on methotrexate and you prescribe for him antibiotics will lead to methotrexate toxicity. What do you think? As I said to Dr. Ida a while ago, follow your sense. What do you think that it is unaccepted? Apologize for this. If you feel it's not and it's just a mistake, it's not it's just a side effect, no need to apologize and be sorry for what happened to him. That's it. The unaccepted
Sorry.
mistake, apologize, and the side effect, be sorry without apologize. Is it clear now?
Yes, yes.
Yeah,
Thank you.
okay. Thank you, Dr. Hassan. Okay, methotrexate, if explain, Dr. Nora, if explain and ask for baseline and follow up CBC and liver enzyme. Stress that the MI methotrexate is once weekly. I am methotrexate once weekly because I see patient take it every day and he had severe toxicity, leukopenia, and liver failure. This is mistake if prescribed by the doctor like this. But if he take it by himself, my mistake, why I apologize? Because he's the one understood. But he always, the patient will follow the frequency, what's written in the box. But if he took it by mistake, this is not your mistake. This is the patient mistake. There is a scenario also like this.
عشتيدك. Dr. Basim,
Yeah.
it is allowed.
Yes.
It is allowed for me to apologize upon my colleague. You
Yes,
think
sure,
these
why
ethical
not?
things?
Yeah, why? Because you are a team. It's a teamwork. The same one why you are defending your colleague and the patient is asking, give me the patient, the nurse name or the doctor name, and you are saying, no, I can't give. Why? Because this is teamwork and we are dealing with the patient as a teamwork and so on. It's the same. The mistake happened by your colleague. Now you will not apologize. You are not teamwork.
But
He's in
I
your
don't
team.
know. Okay, but I don't know the everything regarding the explanation of the GP to the patient in the first time. What if the patients he didn't follow up his results, his lab test? What if the patients he has taken it intentionally
No,
to become
Dr. Nail,
overdose? Because
there
I
is,
don't know everything. How can I
yes,
apologize
but
on my
the
GP
no,
of
no.
my colleague mistake? My colleague.
You will deal with each scenario differently. You are talking about a lot of scenarios and you are confusing and mixing them. Every scenario will be different. So don't judge all scenarios as one scenario.
No,
The
no.
scenario you are talking about, yeah, tell
My
me.
comment is specifically about the side effects, the high dose of my colleague GB prescriptions. The GB in the other area, my colleague, prescribed these
Okay.
drugs to these patients, and even in the scenario written that the patients took it too much. Okay,
Yes.
I don't think they will written in the scenario that your GB he didn't explain to the patient. So I cannot judge that my colleague he didn't explain the side effect or the follow up well to the patients because in any way I don't know what happens previously. So how can I
By the way,
apologize upon my
by the
GP
way, yeah, by the way,
of my colleague?
yeah, if the scenario is clear, there is mistake, you can admit the mistake. But if not
Admit,
clear,
yes.
as
Admit,
you are
admit,
saying,
yes.
assuming, so this
Acknowledge the
time,
mistake.
be sorry for him. Be
Yes,
sorry
be
for me,
sorry.
okay?
Yes,
Yeah.
yes. وصلنا
Yes.
لنقطة اتفاق. أشتيدك.
Yes. Okay.
Acknowledge,
So,
acknowledge and admit.
yeah. Yes.
And be sorry. Yes.
And if
Yeah.
if frankly the mistake
Dr.
is clear.
Basim,
Yes, Dr. Said.
Dr. Basim, shall I start the case?
Yes. Okay. Let's start. Dr. Hassan,
Yeah,
we can continue our discussion at the end because Dr. Nusayba
أشتيدك.
is busy. Okay.
أشتيدك حبيبي.
يلا Dr. Abdul Menaim, I will share the timer, then you can start.
Okay.
By the way, Dr. Abdul Menaim, the patient name is I wrote patient name is John and the wife Lisa. Okay.
Okay.
Okay, here you go.
Hello.
Hello.
My name is Dr. Ahmed, one of treating doctor on clinic today. May I confirm that you are Miss Lisa, the wife of Mr. John?
Yes. Yes, I am.
Miss Lisa, we are here today to discuss some issues related to your husband's health status. Is it okay with you?
Yes.
Okay, before we start, just to be on the same page, can you please tell me how much you know about your husband's health status?
Yeah, actually, doctor, my husband is very well. Just have this high body temperature, and after that, and high body temperature, and think we have common cold. But after that, this temperature not coming well, and have this back pain. Tell me there is neck pain. I actually bring him to ER here. After that, I cannot see my husband, and then I don't know what's going on with my husband, doctor.
I'm sorry about what happened for your husband. We will help you as much as we can. Okay, Miss Lisa, do you have any expectations what could be behind these symptoms?
I don't know, doctor, but may have become cold, or somebody tell me there is serious infection. I don't know, doctor.
Well, Miss Lisa, as you said that these symptoms, yes, your husband came to the hospital with these symptoms, and the treating doctor did some investigation, including the sample taken from his back, and the result of his test now in my hand, and I'm afraid to say that it's more serious than common cold.
Yeah, what happened, doctor? What want to tell me?
The test results confirm that he has meningitis, meningococcal. Sorry, sorry. Just I want sorry for 1 second. The diagnosis is meningococcal septicemia or meningitis.
Meningitis.
Okay, so the test confirmed that he has a serious disease called meningitis. Have you ever heard about this?
No, doctor.
Let me to explain you, and yes, I will draw in now. There is pain. So meningitis is a soreness in the covering layer of the brain. When this causes soreness, this leading to the symptoms, including this high body temperature, neck stiffness, and sometimes this infection may spread to the blood and cause poison to the blood, leading to the serious infection. I'm sorry to be the one who delivered this news for you.
Doctor, I can't get you. I can't get you.
Well, okay. Well, Miss Lisa, let me explain you. Normally, there is a brain. In our brain, we have covering layers. This covering layer sometimes got some bugs infection and cause soreness to this layer. And this giving these symptoms, including the high body temperature and stiff to the neck. And sometimes this bug infection cause serious complications, sometimes may affect the hearing, sometimes affect the vision, and sometimes might cause limb weakness. And in some cases, cause this bug infection is spread and causing spread to the blood and cause poison to the blood, leading to the serious disease. Am I clear so far?
Dr. Nusaiba, we can't hear you if you are talking.
Yeah, just now I talking. Means that my husband is have this in brain inside, this bug infection inside his brain?
Yes, in the covering of his brain. And these bugs must sometimes spread to his blood and cause poison into the blood. I'm sorry to tell you this news, but be sure we are here to help him and to give him support that he needs.
Yeah, doctor, please help my husband, please.
Yes, just another bad effect of this bug infection sometimes may affect the gland above his kidney called suprarenal gland. This affection might cause even to more deterioration, worsening his condition, and might lead to dropping his blood pressure, and sometimes may even threaten his life. I'm so sorry to tell you that, Ms. Lisa.
Yeah, doctor. Really, I don't know how to do.
Yes, since this deterioration has happened, we will refer him to intensive care unit, and there will give him the best treatment, and we will keep him in isolated room, in a side room. We will keep him since this disease is notifiable. We will notify the infection control team, and we will notify preventive department. Am I clear so far, Ms. Lisa?
Yeah, means that now I can. What's this syndrome, doctor? I don't get it.
Well, this disease can be transmitted to one to another by droplet. That is why we need to keep him in a side room, and we will be taken care of by a group of specialists, including the nerve doctor, eye doctor, and ear doctor, and specialized nurse to give him best treatment. Since this meningitis is notifiable disease, that means we need to notify the preventive department. When am I clear so far, Ms. Lisa?
Yes, doctor. I can understand you.
Well, this preventive department will trace the close contact for your husband, and they will contact them. Then, if they have any symptom, they will give him a treatment, and if they don't have, they will give him just preventive medicine. Am I clear so far?
Yes, doctor. Means that my husband will be inside these rooms and nobody will see him. Really, I want to see my husband. And also, he want to see his father.
I can understand your feelings, Ms. Lisa, but in this situation, it is no. I'm sorry to tell you that it's not allowed to visit him, because, as we have discussed, this disease can be transmitted from this can be transmitted from person to another. So the right thing is to keep him, to not visit him. And regarding your second concern, Ms. Lisa, even the children has more chance to get this infection. So it's not wise to visit, because their defense system is not well developed. I hope you understand this point, Ms. Lisa.
Yes, I can get it. I can get it, doctor. So yeah, means that I cannot see my husband even from glass.
Yes,
from
you
the
can.
window.
I can understand your feeling, Miss Lisa. Yes, you can see him behind the glove, and be sure. I want to show you that your husband will be taken care by a group of specialists and will give him a best care and treatment.
Yes, thank you, doctor.
Welcome. So, may I ask you some questions, Miss Lisa? Did you do you what's your job? What's your husband's job?
He is a teacher.
Well, we will contact the social worker to, and who will he how many person depends on your husband?
Me and my kids, doctor.
Well, we will refer you to social worker to see how he can help in these issues, Miss Lisa.
Yes, doctor. Actually, nobody to stay with my kids. I stay here in the hospital for last 3 days.
Well, I can understand your feeling, but in this case, we can also help you. We will contact with a social worker with how to help you regarding the children, and be sure that we will give you help that you need, Miss Lisa.
Yes, doctor. Doctor, you want there is any need to take medicine for prevent this infection to come to my kids?
Well, as we have this, I highly appreciate your concern, Ms. Lisa. As we have discussed that the preventive medicine, they will contact all the close contact for your husband, and if yes, if you have any symptoms, they will give you treatment. Otherwise, if there is no symptoms, they will give you a preventive medicine, or I mean oral medicine to reduce the chance to get this infection.
Yeah.
I hope this is clear, Ms.
Doctor,
Lisa.
means that no, there is no chance to get infection from my husband?
No, there's a chance to get, as we have discussed, this infection can be transmitted from person to another. Yes, there is a chance to get this infection. That is why we need to give you a preventive medicine and preventive medicine.
Okay.
Okay,
Okay. Thank
time
you,
is
doctor.
up. Yeah,
Okay.
time is up, and I added extra 1.5 minutes just to
Okay.
finish all concern. Yeah, let's.
Okay. Do you have anything you want me to repeat or something you want me to ask, Miss Lisa?
No, no, doctor. Thank you.
Then I will give you a website and to know more about this disease and how to protect yourself and your children, Miss Lisa.
Yes. Thank you, doctor.
Thank you. Thank you.
Okay, thank you, Dr. Abdul Manan. We will hear the comment from. Well done. Let's hear the comment, then I will comment.
Okay.
Please, Dr. Desai.
Dr. Basim, you can comment. I want to finish my
Okay,
debate.
you're busy. Okay, so I will
Yeah.
comment. I wrote
Okay.
everything. Okay, so let's start from the
يحيى
beginning.
دخل لي عم حسين على الاكونت حقي.
Wait.
لا دخل تاريخ اليوم.
Okay, let's start from the beginning. Dr. Abdul Manan, the introduction, confirm the patient data, and wife. Next of kin you can ask, invitation you can ask because the patient already comatose. I don't think you read this word, isn't comatose or no? He's not comatose? No,
I
he's not.
think that no, it's not comatose.
No, it's not. Yeah, I thought it's there. That's why I wrote you can invite. But anyway, deteriorated and admit to ICU without intubation. Okay, let's go ahead. The idea about the disease and the expectation, you did everything well. The explanation, yes, it's infection inside the layers of his brain and being sore. I don't know why soreness. It's infection. That's infection only. It's no need to be sore or not sore. It's an infection. The bug reached to the layers of the brain and covering layers of the brain. You can draw as you did. The complication I like when you explain the pathology, okay? Then the symptoms, the headache and the fever, then the complication. It's very nice to mention the complication. It's wise. The hearing, the vision, the What else? The seriousness of the infection, adrenal glands, the glands over the kidney, and the spread to the blood up to threaten his life. You're right. The coma and up to life threatening. You're right to do that because it's serious infection, and some patient, if reached to the coma, means the mortality will be high. And you kept asking, am I clear so far? Am I clear to you? This is good way for the communication. Then the ICU explanation that the patient admitted due to deterioration and notifying disease. You notify the infection control and the job of the infection control to trace contact. This is one of the hidden agenda, and you did it perfectly. Trace contacts, and since he's teacher, we should trace the contacts for the last period. Try not to specify how many days or how many weeks or whatever. Okay, then she raised the concern about seeing her husband. You said no, but when she asked about seeing him behind the glass or the window, you accept. So why you refuse totally? You can open the door even. I mean the door of visiting with precaution. Meningitis patient, if intubated or even not intubated, they can use the precaution to visit only the first degree relative. And they wear everything as droplet infection, as you said, droplet precaution. But don't say droplet for here. It's one of the mode of transmission, but no need to mention droplet because it will be jargon. And she might ask you what the meaning of the droplet, okay? And all with the isolation will be for example, 48 hours, not forever. If he received antibiotics,
Dr. Basim, just
yes.
I want to know, is it allowed to visit in case of meningococcal meningitis?
Yeah, what do you think?
I think it's
We are
not allowed.
allowing. No, we are allowing with precaution.
Okay.
Okay, if not allowed, so no one will enter to him. Okay, you can minimize, but you will allow. Yes, close family, as Dr. Sarah said. Thank you, Dr. Sarah. Close family or first degree, the husband, the wife, the son, the father, but not everyone. If someone came to you, I am his cousin, I am his friend, you will allow? No. Even it's not, he's not concerned to visit him. Even the information, I might not disclose the information for him. Okay. So this is regarding the visiting point. Then the kids, as you did, the kids' defense system is not well performed or developed. That's why we prefer not to be inside and visit him. We can see her, or their father from the window. Lastly, the job and the dependence and some social. And you can add here also if written a coma or intubation, you can add the lasting power of attorney and advance directive, assuming that the patient capacity already lost and his condition being critical and the mortality rate is high and he might not recover again.
Dr. Basim, I have one comment, if you allow.
Yes.
I
Sure,
think
sure.
in case of acute deterioration, no need to ask about AD and LDA because this is acute deterioration, not chronic disease.
But the point is the mortality or the prognosis. It's not related to the acute or the duration. The same as motor neuron disease. It's progressive disease, regardless the period of the progression. He might, yes, take long, but still, since you sit with the family of motor neuron disease and you explain the progression of the disease, and the patient might lose his capacity at any point, you can ask this question. The same as for this patient, intubated or he admitted to ICU for the coma or whatever. I'm not sure if coma, the patient in coma. But since deterioration and admission to ICU means he's in critical situation and he might lose his capacity in the coming days. He might be in coma according to the scenario. If written like he's not, no need to ask. But if he is deteriorated and admitted and comatose, especially those with coma, you can ask this kind of question. This is my opinion. I hope you accept this comments. Let's read the comment. Dr. Sarah said, close family. Abu Mazen, infection control precaution, wear gowns, yes. Wear gown, mask, and gloves. Yeah, he can visit with full precaution, more than for Clostridium infection. It might be the mask added, but for the contact precaution, no need for the mask, only gloves and yellow gown. Dr. Hosna, yes, we can see the patient, close family, yes, I agree. Thank you, Dr. Abdelmanem, as well. Thank you so much. Any question, any comment regarding this scenario? Is it clear? In acute setting is young for in acute setting, no need for LPA advanced directive, Dr. Terhab said. But I think patient is young for LPA or yes, some patient and young patient they are not expecting that they will be in critical situation. But for example, the point of donation, no need to mention it, and he's young. But in the license, he put like I agree for donation. No one expecting when he will be in this trouble, but it's not a rule. This is my opinion also. If someone want to follow whatever the monitor or whosoever, I'm thinking this is my feeling about the point of lasting law of attorney. Once the patient loses his capacity, I can ask, even he's young, even he's acute. This is my sense, and I follow all with this sense. But I think patient is young for LPA, okay, especially it is curable like meningitis. Who said some meningitis patient who gets they might lose and may be in coma, and the mortality rate is high, especially if intubated and admitted and he has coma. Or some persons or some patient might recover partially with some neurological deficit. Agree with Dr. Basim, Dr. Hassanin. Yes. Prophylaxis for close one. Yes, he mentioned Dr. Roda. Prophylaxis for close contacts. Again, I am not, I'm just commenting and giving my opinion. And everyone has his school to follow, either mentor or book. But I'm collecting all these thoughts and my opinion based on a lot of lectures and experience with some doctors. Not experience as active, but some I listen to most of the mentors, and every point you can do follow or you disagree. It's up to you. If someone believe on my opinion, he can follow. If others doesn't, it's okay. I'm not forcing. I'm just giving my opinion. In case of deterioration further and reduce the capacity, do you nominate anyone for this situation? Yes, you're right, Dr. Basil, Dr. Abu Mazen. It depends on the scenario. Yes, I think we can talk about advanced directive in this killer disease. Thank you, Dr. Hassanin. Thank you for the interaction. I hope I can hear all of you. No need to just write. Anyone can talk. I'm not muting.
I just want to say regarding the meningitis.
Yes.
They didn't say
Thank
it's
you, Dr. Sarah, for commenting.
no problem. It's not
Give us
bacterial.
your feedback, okay?
Yes, it's not saying bacterial meningitis to talk about the adrenal complication. It could be viral meningitis. So that's why I'm
No,
saying
in this scenario, I guess it's meningococcal or not?
no meningococcal, no bacterial, no virus. It's written meningitis only.
Okay, meningitis only. Yes, you're right.
Yes,
I
and
think
as you
I think
said,
it's meningococcal because the only meningitis that need preventive medicine, I mean isolation, it is a meningococcal meningitis. Otherwise,
No,
if the cause of meningitis viral, no need for isolation.
Only for viral meningitis need enteric isolation, I think. Wash the hand
Yes.
and enteric isolation because
Yes.
it's
Yes.
coming from the stool. But the bacterial meningitis only isolation for 24 hours after starting the antibiotic. And
Yes.
and if in the ICU also, and he's on ventilator, maybe there is splash of water. They can use glass for also isolation. I think this is the same. But no need to talk about the complication of suprarenal adrenal complication because they didn't say it's bacterial meningitis.
Yeah, I
Meningococcal
agree.
meningitis, something.
Yeah, I agree. I misunderstand also it is meningococcal. But
Mm,
if not specify the organism, yes, no need to talk about such
yes.
complication.
Yes.
Yeah, I agree
But
with
there
this.
is يعني skin rash and neck stiffness. So do you think it is
Yes. Yeah, that's why, Dr. Sarah. Yeah, skin
Oh,
rash me. Okay.
okay.
Thank you for
Yes,
correcting. That's
yes.
why I thought it's meningococcal. Yes, skin rash. Yes, you're right,
Okay.
Dr.
clinical
Yeah,
judgment. Yes, a clinical judgment, please.
yeah. Thank you.
Okay.
Yes,
Okay, you are right,
yeah,
sir. Didn't notice the
yes.
skin.
No,
Okay.
no, no. That's why also I put in my mind it's meningococcal because of the skin rash. Yes, even it's not written in
Yes.
the finding, but it's going with the skin rash. Yes, you're right.
Thank
Thank
you.
you, Dr. Abdulmenaim. You did it great. And thank you, Dr. Sarah. You are our backup in the infectious disease. So
Okay.
let me ask you the question for
Yes.
the notifiable disease. Is
Yes, I think
Clostridium,
for Clostridium, when we have in the word Clostridium difficile, automatically the infection control team are writing a note that this patient has a
yeah.
Clostridium difficile and should be under enteric isolation precaution by wearing the
So,
apron and the gloves while entering
yeah,
the room. And the patient should be in the side room. So I
yeah.
don't
So
know.
it's notifiable. Okay.
Yes, the infection control should be in the hospital, should be aware about any
Yes.
MRSA, any para-influenza, influenza, all this infection, because it can be transmitted between patients. That's why they need to be aware and to transfer the patient from the bay to the side room and do
Yes.
and it will be on the room from outside every room. It will be written this patient enteric isolation precaution. So anyone can enter the room, know this enteric. So I wear an apron, I wear a mask, and I wear gloves. If an other room is written, it is respiratory isolation. Every room, it's on every side room. If there is infection on the door, there is a paper written. This is respiratory isolation. This is enteric precaution, respiratory precaution. So the infection control team in the hospital should be aware about this in order not to spread the infection between patients.
Yes, I agree with you, Dr. Sarah.
Yes.
But Rhoda also added, yes, very important comment. There is what's called public health. This is different than infection control.
Yes.
So the public health,
Maybe notifiable to the public health outside the hospital. There's some people
yes,
to notify them.
yes,
But inside
yes,
the hospital, the infection control should be aware about all the infectious disease.
yes.
But I think the Clostridium difficile is not a notifiable to the there is a
Outside
team
to the public.
outside. Yes, but there is some team called fever and the fever which is critical fever outside the hospital, as Lassa fever, as dengue fever. Some of this infection should be notified, including the meningitis,
Yes,
but not the
yes,
Clostridium. But the Clostridium is notified inside the hospital by the infection
yes,
control.
yes. I agree with you, Dr. Sarah. Yes, you're right. And thank you, Dr. Roda, also for raising this issue. Notifiable to the health, the public health is different. By the
Yes.
way, meningococcal meningitis, one of the notifiable to the public health.
Yes.
Yes. Okay. Thank you, Dr. Sarah. Thank you, Dr. Roda. Thank you so much, all of you, Dr. Musaiba, Dr. Abdulmenaim. Any question, any comment, any missing points? Both Clostridium and MRSA, only isolation, infection control, no public. Yes, exactly. Or contact. Yes, I agree also. This is the scenario, or this is the two scenarios notifiable to infection control team inside the hospital. Outside the hospital will be serious infection.
Okay.
Yes.
What, Dr. Basim?
The notifiable to the public health, the serious
Different.
infection Yeah, from outside the hospital, from outside the hospital.
Yes,
Like
we are
our case
notifying.
today, meningococcal.
Yes, for we have notification for infectious team in the hospital, and we have notified to the يعني public health. There is
Yes,
a
exactly.
difference between.
Difference,
regarding
yes,
the
yes.
yes, regarding the question of our colleague about the student, because the patient was a teacher. Yes,
Yes.
I think only the close relative, close, and the close
No.
they have a special term or تعريف معين للclose. I think يعني the relative must spend more than 6 hours or 5 hours in 2 meter يعني
Okay.
distance, I think, but I don't sure.
Let's have a deal. Let's have a deal about this point. Who will decide for the contact to be traced? No, they are not. We are not the ones. Okay. Let's have a deal for this. The one concerned for this are the infection control or the public health. Even if she or he or the relative ask you this a concern, still here, because I don't know who will be in close contact or who will be with symptoms or with no symptoms, and I am not the one who will go to screen for them, right? So why I put myself in this trouble? I will just refer it to the public health or to the team concerned to this point. So don't bother yourself about the timing of close contact and how long the period and who will be and who will not be. This is my opinion, and it was one of the concern today. And Dr. Abdelmenem, I think he answered here by himself, and supposed to say, no, it's the public health or the team concerning this the contact tracing, not my job. It's related to a team, and this team will will answer you and will address your concern. For the clinical judgment, let's ask Dr. Sarah if she's not if it's still with us. Dr. Sarah, are you there?
Yes.
Yeah. So the contact for meningitis, I
They
think,
should,
yeah,
yes, the contact for
student also.
meningitis. Yes, we can say that we can notify the infections control team and the occupational health team. They will trace the contact and they will give them chemoprophylaxis, and usually are giving ciprofloxacin instead of rifampicin.
Yeah. But again, it's not our
No, yes, it's not
task.
us. Yes, but
Yes,
we need
it's
to
not
tell
us.
them that we should make them know that we know that this is communicable, and we should trace the contact, the close contact to the patient, so they
Yeah.
can have the chemoprophylaxis for meningococcal
Yeah.
meningitis only.
Yes, for meningococcal. And by the way, the job of being teacher, it's a clue to also to screen the student. This is what I heard from this about this scenario.
They can,
It's
because
not
they
only.
will notify. Yes, I think they will. What they will do, they notify the school, and they will give all the student chemoprophylaxis.
Exactly. Yes, I agree with you. Okay, thank you, Dr. Sarah. Thank you, Dr. Hassan, for raising this point.
Yeah.
And thank you all, Dr. Dumena and Dr. Musaiba, two important scenarios and more high yield, I mean, in the exam. Frequently, we are seeing this scenario. Yeah, thank you, Dr. Habib, as well. Tomorrow, we will have a long clinical consultation, and we will take the participant after stopping the record if no question and no comment. Thank you all. Thank you, Abu Mazen. Thank you. I will stop recording.